This episode is crafted as a companion to Therapy Training's HIV/AIDS Considerations training course, focusing on a vital topic that affects countless individuals and communities worldwide. Whether you're an experienced mental health professional or new to the field, gaining a deeper understanding of HIV/AIDS is key to delivering compassionate and informed care. Join us as we explore the complexities of this issue and discuss how it can shape your approach to mental health practice. In this episode, we'll cover key aspects of the course, including the fundamentals of HIV/AIDS, what it is, how it's transmitted, and its impact on individuals. We'll also explore the psychological and social implications of an HIV/AIDS diagnosis, the stigma associated with it, and specialized approaches for supporting clients affected by this condition. Plus, I'll address some common misconceptions surrounding HIV/AIDS and provide strategies for combating these harmful beliefs. Now let's start with the basics. What exactly is HIV/AIDS? HIV, or human immunodeficiency virus, is a virus that attacks the body's immune system, specifically the CD4 cells, which help fight infections. If left untreated, HIV can lead to AIDS, or acquired immunodeficiency syndrome, which is the most severe phase of HIV infection. It's crucial to remember that HIV is a manageable condition with proper medical care. Many people living with HIV can lead healthy, fulfilling lives. When we discuss transmission, it's vital to understand how HIV is spread. The most common routes of transmission include unprotected sexual contact, sharing needles or syringes, and from mother to child during childbirth or breastfeeding. It's essential to emphasize that HIV is not transmitted through casual contact, such as hugging, shaking hands, or sharing food or drinks. This misconception can perpetuate stigma and fear, which we'll delve into later. Now, let's consider the global impact of HIV/AIDS. According to the World Health Organization, more than 38 million people worldwide are living with HIV. Sub-Saharan Africa bears the brunt of the epidemic, accounting for nearly 2/3 of all people living with the virus. However, it's important to recognize that HIV/AIDS affects individuals from all walks of life, regardless of geographical location, race, gender, or socioeconomic status. Each person's experience with HIV is unique, shaped by their cultural context and personal circumstances. As mental health professionals, understanding these diverse experiences is crucial for providing effective support. People living with HIV may face a myriad of psychological challenges, including anxiety, depression, and feelings of isolation. The diagnosis can trigger a range of emotions, from fear of illness to fear of rejection. In our course, we discuss specialized techniques for supporting these clients, such as trauma-informed care, which acknowledges the deep emotional scars that can accompany an HIV diagnosis. Let's take a moment to reflect on the psychological implications of an HIV/AIDS diagnosis. Imagine receiving news that could change your life forever. For many, the initial response may be shock or disbelief. As therapists, we must create a safe space for clients to express their feelings and fears. Active listening and empathy are vital tools in our toolkit. One approach discussed in the course is motivational interviewing, which can help clients explore their feelings about their diagnosis and develop a sense of agency in their treatment. And then, of course, there's the stigma. Stigma surrounding HIV/AIDS can be both societal and internalized. Societal stigma refers to the negative attitudes and beliefs held by the public, often rooted in misinformation and fear. Internalized stigma occurs when individuals absorb these negative beliefs about themselves. This can lead to feelings of shame, guilt, and worthlessness, which can further exacerbate mental health challenges. So how to combat this stigma? One effective strategy is education. By providing accurate information about HIV transmission, treatment, and the realities of living with the virus, we can help dispel myths and reduce fear. Additionally, fostering open conversations about HIV/AIDS in our communities can promote understanding and acceptance. As professionals, we can advocate for our clients and work to create environments that are inclusive and supportive. Now, let's talk about cultural considerations. The course emphasizes the importance of recognizing and respecting the diverse experiences of people living with HIV/AIDS across different cultures, races, genders, and socioeconomic statuses. Cultural beliefs and practices can significantly influence how individuals perceive and respond to their diagnosis. For example, In some cultures, discussing sexual health may be taboo, making it challenging for individuals to seek support or treatment. As therapists, we must approach each client with cultural humility, acknowledging our own biases, and being open to learning from our clients' experiences. This means asking questions, being curious, and adapting our approaches to meet clients where they are. Understanding cultural contexts can enhance the therapeutic alliance and create a foundation of trust. Now, let's touch on the ethical considerations when working with clients living with HIV/AIDS. Upholding the rights of these individuals is paramount. This includes respecting their privacy and confidentiality, as a diagnosis can lead to discrimination and marginalization. It's crucial to foster a non-judgmental atmosphere where clients feel safe to discuss their thoughts and feelings without fear of repercussions. In our course, we also explore the importance of collaboration with other healthcare professionals. HIV care is multidisciplinary, often involving physicians, nurses, social workers, and mental health professionals. By working together, we can provide comprehensive care that addresses both the medical and psychological needs of our clients. Communication and teamwork are key components in ensuring that our clients receive the best possible support throughout their journey. Now, let's pause for a moment and address some common misconceptions surrounding HIV/AIDS. One of the most pervasive myths is that HIV is a death sentence. While it's true that HIV was once considered a terminal illness, advancements in treatment have transformed it into a manageable chronic condition. With proper medical care, individuals with HIV can live long, healthy lives. Another common myth is that only certain populations are at risk for HIV. In reality, HIV can affect anyone, regardless of their sexual orientation, gender identity, or lifestyle choices. It's essential to challenge these stereotypes and promote the understanding that health is a universal concern. Let's also consider the misconception that people living with HIV are promiscuous or irresponsible. This harmful stereotype not only perpetuates stigma, but also ignores the complexity of individual circumstances. Many people living with HIV contracted the virus through no fault of their own, and it's crucial to approach this topic with sensitivity and compassion. As we wrap up this discussion, I want to leave you with some thought-provoking insights. The journey of living with HIV/AIDS is not just a medical one, it's deeply emotional and social. As mental health professionals, we have the opportunity to make a profound impact on the lives of our clients by providing support, understanding, and advocacy. I encourage you to take what you've learned today and apply it to your practice. Consider how you can incorporate these insights into your work with clients. Whether it's challenging stigma, advocating for rights, or fostering cultural sensitivity, every action counts. If you're looking to deepen your understanding of this critical topic, I highly recommend visiting therapytrainings.com. The HIV/AIDS Considerations training course offers a wealth of information, practical techniques, and resources to help you better support your clients living with HIV/AIDS. Thank you for joining me today. Let's continue to educate ourselves, challenge misconceptions, and advocate for those living with HIV/AIDS. Together, we can create a more compassionate and informed world. Until next time, take care of yourself and each other.